Well, I'm here at Regional Medical Center on a beautiful day here in San Jose, one of the busiest hospitals in the region, home to just one of 3 trauma centers in all of Santa Clara County. It is a lifeline for our entire community, but I don't take for granted that I get to be here right now, because just over a year ago, we almost lost this hospital. And the story of how it was saved speaks to a lot of what's broken in our healthcare system in America today and how we can build something better. The American healthcare system faces a lot of challenges. One of the most alarming trends, though, is the rapid rate of hospital closures. In fact, a recent Kaiser Family Foundation study showed that in the last decade, we lost more hospitals than we gained in this country, even while our population grew and got older. So if the need for care is rising, why are hospitals disappearing? In a word, profits. Private hospitals compete aggressively to attract privately insured patients because it's easier to make money. But that leaves out millions of Americans who buy their own health insurance or who are covered through public programs like Medi-Cal and Medicare. And in that kind of system, all of us are at greater risk. This hospital is a good example. When the previous ownership ended trauma services in 2024, it pushed all of those patients to our only other trauma center in San Jose at Santa Clara Valley Medical Center. And in 2025, SCVMC became the busiest trauma center in the history of California. That is not something to celebrate. That is a warning. In a medical emergency, we want care that's close and available to us when we need it. But in a healthcare system largely driven by profit, it's no one's job to make sure we have enough trauma centers and emergency rooms where we need them, unless you live in Santa Clara County, where we have a strong public healthcare system that's willing to step in and face big challenges. When the county acquired Regional Medical Center in 2025, it wasn't just about saving a hospital. It was about protecting care for all of us, and to show that you can build a healthcare system that actually puts people first. Regional Medical Center is what a success story looks like, not just for today, but for future generations that will rely on this hospital for their care. Our county is showing that with vision and determination, you can protect the care of all people and build a model for how healthcare should work in America.